My name is Presley Turney,
And I'm Michaela Maddox.
and this is for our class Anatomy and Physiology 2401-102.
And this is our extra credit assignment over the bones of the skull. So first, we'll be talking about the cranial bones. So the first bone we're talking about is the frontal bone, and its main function is to create a smooth curvature of the forehead and to also provide protection for the frontal lobe of the brain. The frontal bone is a large bone that makes up the forehead and supplies the upper edge and roof of the orbit or the eye socket. The frontal bone is located where the forehead is on the skull. Next, we have the parietal bone, which are two flat quadrilateral bones that cover part of the top and sides of the head. The parietal bone joins together at the top of the head, so are often referred to as a singular bone. The function of this bone is to form shape of the head and protect the soft tissue of the brain. Next, we have the sphenoid bone. It has a variety of many essential functions, and the bone helps form the base and lateral sides of the skull in combination with the orbital floor. Its many articulations with other bones give the skull rigidity. It is an attachment site for many of the muscles of mastication. The sphenoid bone also has a unique shape like a butterfly. So breaking the sphenoid down into its parts, if you will, we have the lesser wing, which arises from the interior aspect of the sphenoid body in a superior lateral direction, and it separates the interior cranial fossa from the middle cranial fossa. And then you have the greater wing, which is one of the components of the sphenoid bone, again, which projects laterally from the central body and form the interior and medial portions of the floor of the medial cranial fossa. Now we have the ethmoid bone, which is a spongy, irregular bone of the skull. It is located anteriorly in the cranial base and contributes to the formation of the medial walls of the orbit, nasal septum, and the roof and lateral walls of the nasal cavity. Next, we have the temporal bone, which houses the cochlear, canals, and hearing organs. It also protects the middle and inner ear structures, which are more delicate. There are two temporal bones that rotate around a triangular shaped bone, the occiput. The temporal bones are located on the sides of the skull behind the orbits. Next, we have the occipital bone, which is the most posterior cranial bone and the main bone of the occiput. It is considered a flat bone like all other cranial bones. The primary function of the occipital bone is either for protection or to provide a broad surface for muscle attachment. The scalp, which consists of 5 layers, covers the bone. Now, part of the mandible is the ramus, and it is two vertical portions, or rami, from moving hinge joints on either side of the head, articulating with the glenoid cavity of the temporal bone of the skull. The rami provides attachments for muscles that are important for chewing. So now here's some of the neck bones in a lateral view. So this is the lacrimal bone. You can see it here. It's green. The lacrimal bone is a paired facial bone located in the medial wall of the orbit. Its main function is to provide support to the structures of the lacrimal apparatus, which secretes tears to lubricate the eyes, as well as acts as a site for orbicularis oculi muscle attachment.
So onto the nasal bone. The nasal bone is located medial to the frontal processes of the maxilla. It is rectangle shaped and thus has two surfaces and four borders. Its superior borders and main bodies from the bridge of the nose. The inferior borders connect with the nasal cartilage to form the superior margin of the nasal cavity. Onto the mental foramen. The mental foramen is a bilateral opening of the vestibular portion of the mandible through which nerve endings such as the mental nerve emerge. The mental foramen is located between the lower premolars. The zygomatic bone. The zygomatic bone is a paired facial bone. Both zygote or cheekbones are irregular and articulate with other bones of the cranium and face. They are important contributors to mastication or chewing, providing an attachment point of the masseter bone, a jaw adductor that closes the jaw. Onto the maxilla. The maxilla, also known as the upper jaw, is a vital vestibular structure of the skull. It is involved in the formation of the orbit, the nose, and the palate, holds the upper teeth, and plays an important role for the mastication as well as communication. Onto the mandible, which is also highlighted in the picture provided. The mandible, located inferiorly in the facial skeleton, is the largest and strongest bone of the face. It forms the lower jaw and acts as a receptacle for lower teeth. It also articulates temporal mandible joints. Onto the structures of the mandible. The alveolar processes contain the alveoli, which is simply a socket which the tooth goes in. The mandible also has multiple foramen that allow the nerves and blood vessels to reach the mandible. Onto the vomer bone. The vomer bone is a thin, unpaired bone of the skull. The major functions of this bone is to form the nasal septum together, which the perpendicular plate of the ethmoid bone and the nasal septal cartilage. The vomer is positioned vertically in the middle of the nasal cavity. The isolated bone has two surfaces and four borders. These next slides will be sutures of the skull. So the first suture we will talk about is the lambdoid suture. The lambdoid suture is a dense, fibrous connective tissue joint on the posterior aspect of the skull that connects the parietal bones with the occipital bones. It is continuous for the occipital mastoid suture. Onto the coronal suture. The coronal suture separates the frontal bone from the two parietal bones. Next, we will be talking about the sagittal suture. The sagittal suture joins the paired parietal bones to each other, as seen from the lateral side. The lambdoid suture unites the occipital and also the parietal bones. On both lateral sides of the skull, the squamous suture connects the temporal and the parietal bones. Next, we'll be talking about the fetal skull sutures. There are two frontals or space between the bones where sutures intersect that protect the soft tissues and the brain. These are called the anterior fontanelle, which is also identified as a soft spot, or the posterior fontanelle. This next slide will be the frontal view and the lateral view of everything that we have discussed, which is also labeled. And then the next slide will be also parts of the skull more identified and color coordinated to the word so you can see it better.